Hello and welcome everyone. My name is David Dayen. I am the executive editor of the American Prospect, and this event is regarding our special issue, which we have released this week on family care, caregiving in crisis, and how to fix it. We got started on this path really many months ago, before the pandemic hit, beginning of the year, actually. We started talking with some of our partners about, really diving in to this issue of family care. When I say family care, I mean child care, I mean paid family medical leave, I mean what is called long-term supports and services, which involves in-home and also outpatient care for elderly people and people with disabilities. So all of those aspects are in a very rickety state right now in the United States. And we decided to explore that and also look at possible solutions. So at this point, I want to bring in Ai-jen Poo with Caring Across Generations. Ai-jen is really a leader in this movement and the fight for a proper care infrastructure and justice for economic justice for domestic workers. So Ai-jen, thank you for being here. We got interested in this just because if you look at the state of things right now, I mean, even though we started this journey sort of before the pandemic, everything that's happened since has served to highlight the need and the gaping hole that we have in our care infrastructure. Can you just sort of identify a little bit about how this affects sort of the issues that are at the forefront of our politics and our economics right now?
Sure. Thank you, David. And thank you to everyone at the American Prospect for putting this issue into the world in this way. So many great articles diving deep into all the dimensions of the care crisis and the incredible opportunity that we have now to address our care needs for the 21st century in a whole new way. And I often say that before there was a public health crisis, there was a care crisis. And it has to do with the fact that that we in this country have never invested in the ability of families to care for their loved ones across the lifespan. And there are many reasons for that: cultural, historical, structural. And what we have now is a situation where, on the one hand, we have a large and growing aging population. As the boomers age into retirement at a rate of 10,000 people per day, turning 65, and then advances in healthcare allowing people to live longer than ever before. And then we have millennials having children at a rate of 4 million babies born per year. So on that end of the generational spectrum, there's a huge and growing need for childcare. And so we need more care than ever before in this country at a time when we have less of it, because most adults in every household have to work outside of the home in order to make ends meet. We have also, before there was a pandemic, there was an epidemic of low-wage work in America, where you have millions of workers who are working incredibly hard and still can't make ends meet. So 60% of our workforce earns less than $50,000 per year. And the average cost of childcare, $9,000, average cost of long-term care, $60,000. Like, I'm not great at math, but those numbers don't add up. It just doesn't work. And the burden falls disproportionately on women, especially women of color, who are taking responsibility more than their share of the caregiving needs of this country, of their own families and communities, but also as professional care workers. as childcare workers, early childhood educators, domestic workers, home care workers, direct care workers, disproportionately women of color and women of marginalized social status who have been deeply underpaid and undervalued in our economy. So much so that the average wage of a home care worker in America is $16,000 per year. I don't know a single place in this country where you can survive, let alone support a family. And so the people that we're counting on as professionals to care for us can't take care of their own families doing this work. So in every way that you look at it, whether you're a family member struggling to manage care for your loved one, you are a consumer of care and you need options to be able to have a dignified quality of life, or live a full life as a person with disabilities, or you're a worker working in the care economy, it's just so broken for everyone. And COVID has just exacerbated all of that, but it's also brought our attention to it in a way that gives us a really unique opportunity to transform it.
Yeah, thank you for that. I mean, that's I was struck by so much in getting sort of a crash course in the care economy. Struck by so much of what you just said. I mean, in particular, this like incredible dichotomy that shows the undervalued nature of this work. That it can be prohibitively expensive and completely in demand, but also not nearly a living wage for actual for the people that do the work. You almost don't see that anywhere else in the economy, and it speaks to this this neglect of building this system. And one of the things you talked about with me in the actual interview that we did, which is part of our network, I should say, is all of the articles are at prospect.org/family care. But one of the things you said was that, you know, the idea that these are job enabling jobs, and that if we're going to build back from this terrible economic collapse that we've had during the pandemic, care is right at the center of that. So could you talk about the role of care in economic recovery and renewal?
Absolutely. From every angle that you look at it, if we invested in our care economy as part of our economic recovery, whether it's in terms of jobs, investing in care jobs, so that these jobs of caring for our families can be living wage jobs with benefits and a union that people can really sustain in and support their family on and take pride in, that not only benefits those workers and their families, but it benefits all of the workers who then need those services in order to work. So if you want to talk about getting America back to work again, that is a key foundational infrastructural piece in order for that to happen. And I would say that the the fact that in September alone, we lost more than 800,000 women who dropped out of the workforce, largely because of caregiving responsibilities, disproportionately Black and Brown women who had to do so. It is such a profound equity issue that we have the opportunity to address. So if we wanted to actually recover into a more equitable economy, investing in the care economy disproportionately benefits women of color who have been hit the hardest in this pandemic, and allows for a part of the economy to be secure that is foundational for everything else to recover and to begin to thrive. And so it's a job enabling jobs, but it's stimulus, and it's equitable.
Yeah, it's amazing. We'll get to sort of the solutions in a second, but I wanted to bring in, we have to have someone to get involved in the discussion who epitomizes sort of the state of family care today. Linnea Redmon-Williams is with us, and she works full-time while caring for both her children and her mother. This is part of what is sometimes called the sandwich generation, people that have care needs on both sides of their generational span. So Linnea, I'm wondering if you could talk about your situation, tell us your story, and really how it exemplifies the need for more support.
Hi, as he stated, my name is Lynnea Redmon-Williams, and I am a sandwich generation caregiver. I have my mother, who lives about a mile away from me. I'm also a wife. I am also a unit director of a Boys and Girls Club. I'm also a preacher, and then I have my daughter at home, who is 11 years old. I have 2 older children, but then I have my 11-year-old. And the impact for this right now is so needed because I find myself juggling, trying to find time to make time to go by, check on my mom. She does live on her own, but she does need assistance. For instance, I find time to go to the store for her. I find time to find out what she needs. Do I need to help her clean up this week? Do I need to help her with her laundry or whatever she needs? And then at the same time, being a wife and then having my daughter at home who's 11, who is on online school right now until January, I find it myself exhausted at the end of the day and looking for time because I don't have it to help her with school and to help her do well in her lessons. Right now, her grades are suffering because I can't give her the attention that she needs, and she's not used to the online learning. And she's in 5th grade. And so this transition, getting ready to go to middle school, I really want her to have that confidence that she needs to be able to transition through classes. And in the midst of all this, I'm struggling. I'm struggling to help everyone that needs help, not to mention I work in the community. And then I see at one point in time, we had to shut down our Boys and Girls Club. So herein lies all the families that she's talking about and mothers that didn't have that after school care or that care period to be able to maintain employment. So I get to see it from all perspectives as well as be a part of it.
Yeah, I thank you. I can't believe that you had time to join this discussion.
Well, listen, and actually with that being said, I just traveled with my best friend to Tennessee to check on her nanny who just got out of a facility and could not be seen because she was in the facility. So we just took a brief break in the week to run down here and check on her, who has all these people coming in during the day, but still it's long distance. And so I'm still doing that.
Right, it's unbelievable, and it shows, Jen, because this is someone who's in all aspects of this as a caregiver to her children, as a caregiver to her mother, as a caregiver to other people in the community who need support. This is what you get, these sort of family connections and these people sacrificing in the absence of a care infrastructure, right?
That's right. I mean, Linnea is the care infrastructure right now and deserves a lot more support. I mean, that's the reality, is that it's a different kind of infrastructure because it's a human infrastructure. And no matter how you look at it, care in America is going to be an all hands on deck situation because there's so much of it to do and support. And it shouldn't be as difficult and broken as it is. Caring is hard enough. Supporting parents who are aging, becoming more frail, loved ones with disabilities, loved ones with dementia. There's so much about this work that is hard enough emotionally from the human experience, but the incredible pressures and really the impossible challenges that family caregivers face as they're trying to navigate these systems and eligibility, and right, it's just crushing. And most people are not eligible for the care that they need through programs. We need to expand those programs and create universal access to the supports that families need. And that's the vision of Caring Across Generation, is to get to a place where we can focus on the emotional dimensions of care and showing up for each other without the stress of having to worry about impoverishing yourself in order to afford to care for the people that you love, or losing your job and losing your economic opportunity as a result of caring for your families, all the impossible choices that we're faced with in the absence of a good infrastructure.
Yeah, absolutely. Now, Linnea, or is it Linnea? Is that correct? Yeah, okay. I mean, one thing that struck me in what you were talking about is that you're also helping friends in your community with their care needs, which is really kind of somewhat typical, that people, you know, find ways to rely on each other and build these systems out of nothing. I mean, one thing I'm curious about is how you manage this with work. So, you know, I don't know if you have, you know, full-time paid leave, if you had to go really take care of somebody for an extended period or anything like that. But how do you manage and juggle these responsibilities that now you have before you?
So at my job, I do have vacation time. And I will say Boys and Girls Club of America does give us a nice amount of vacation time. So with that being said, I have been able to just say, hey, I need to take a moment and go take care of family or do this. But when I run out of that time, what do? I actually also, I just recently had surgery too. So I had to have time off for that. And so I will say you can run out of time. The only reason why I haven't is because I waited until my surgery and didn't take any time. And so you have to really be strategic. And when my kids are on spring break, I can't do that. I'm at the club, I'm serving families because they're on spring break. And so you have to find that leverage. You have to really be strategic in your planning to make sure that you're not running out of time, and to make sure that you are still getting a paycheck while you're off. But under normal situations and circumstances, I know that people don't have as much paid leave time as I do, or they don't even have it at all if they have that benefit at their job to be able to leave. And I don't have to afford childcare at this time. My daughter is 11, but she's still on that cusp to where if I made a decision like, you're 11, you can't be at home for an hour by yourself, what I need to do is find childcare that I wouldn't be able to afford. And so, so with that, and then the time, the paid leave, those things are very, very important to what IGN is doing right now and the policies that she's trying to push forward.
Yeah, thank you. I mean, this is the juggling, the mental gymnastics that people have to do to figure out how can I carve out some time so I can take care of my own self in addition to taking care of everybody else. This is, and when we think about this in terms of solutions, IGN, this is just sort of a perfect example of someone who has care needs that span this entire spectrum, whether it's childcare, paid leave, or long-term care. How would, I mean, we talked in our series about a universal family care system, and how would that help someone like Linnea to manage this better and in a more coherent fashion?
Well, a universal system where we had one fund that we all contribute to, that we could all benefit from, that helps us pay for childcare, paid leave, long-term care, long-term supports and services for people with disabilities, basically everything you need to take care of your family while you're working, right, full-time. Mm-hmm. That kind of a fund would enable people to draw upon the services that they need when they need it in a way that's flexible, but also holistic, right? One of the things that's so challenging is that these policies are treated in silos, where childcare is over here and it's this set of programs, or long-term care is over here and it's this set of programs, and paid leave is totally separately, all of them underfunded if they exist at all. And what we could do is actually streamline so that we have durable resourcing and financing of all of these programs, robust enough to really support higher wages for the workers who are working through these programs. And people could just take advantage of the benefit as needed in a much more holistic way. Oftentimes, the user of these programs is an intergenerational family unit, right? It's not different people who are utilizing these programs. So being able to streamline and think about the user as a family, right? However you define family, and we are very broad about how we define family, but that to be able to think about it in that way, more holistically and in a much more streamlined way, and to be able to finance it in a streamlined, durable way, I think is the goal here.
Yeah, that's terrific. Linnea, I imagine that sounds pretty good to you, given your stresses right now.
I will say that does sound good. That sounds awesome. And if I could just say really quickly that I feel like if this should definitely go beyond paperwork, this should allow people to attain the resources that they need. It sounds like a wraparound plan that would approach and equip all families. And this would help them to, me, myself, all of us, to feel secure. And I think that looking at this generationally, not only would this help me, but this would help my children, and this would help my children's children. They haven't had children yet, but that would definitely help them. And I think that that's the approach. And I think about the term, it takes a village. It sounds like this plan is for the village, right? Because it does take a village for all of us to do it.
Yeah, absolutely. Thank you. The way I think of it is, this question will be for IGN, back in the 1930s, we recognized that we had this real problem with elder poverty. It was an absolute epidemic in the United States, and the public sort of cried out for some sort of solution, and it came in the form of Social Security, and that was a social insurance fund that could pay for, build up a fund through time so that people could have a certain measure of dignity in retirement, and over time it was expanded, and it really works incredibly today. That was instituted at a time when the economy was in an absolute crisis, right? We think about these things, these days we have people who say, oh, how are you going to pay for that? We can't take on these new programs when we're in the middle of this economic downturn, things like that. But in the 1930s, that's exactly what we did with Social Security. And we came up, we built a village together, all paying into the system, and we created a solution to one of the biggest problems in society. Do you see the stars aligning for a similar thing today, coming out of this pandemic-induced recession, which we hope doesn't become a depression, that we can take on this big thing right now and have it become something that lasts through a problem that existed before the crisis, and finding a solution?
Absolutely. We came up with $500 billion to bail out companies overnight at the beginning of this crisis. If we can do that, we can do at least as much to bail out families who have been struggling for so long and are now in the deepest crisis of generations. And I think it is an opportunity to reset similar to the 1930s. So many of our policies and so much of our social contract is outdated, right? It emerged at a time when we had a very different economy, a nationally based, manufacturing rooted economy. We now have a service-driven economy, unprecedented levels of inequality, and tons of workers who are not made safe by our safety net. And we have to really rethink and reimagine what the frameworks are that are going to support us into this next era. And this is an opportunity amidst all of the disruption of the pandemic to do that. Now, if people feel like there isn't time to reimagine everything, that's okay. We can still put hundreds of billions, if not more, of public dollars into the existing care systems to expand access to services. And we can do that tomorrow to make these jobs living wage jobs with benefits and a union. That can happen literally tomorrow. Congress just has to do it. And I think we've done it before, we can do it again, and they need to hear from all of us that that's what we want.
Yeah, I mean, I think the key, Linnea, is valuing the work that people like you do, which goes uncompensated, right? The part of it that's caring for your children and your mother, but is completely vital to any society. You know, Jen and I in the interview talked about, you know, what do we do with uncompensated caregivers who contribute hundreds of billions of dollars to the economy. And, you know, I mean, I guess my question, Linnea, is would a system like this make you feel more valued as a contributor to society and a contributor to families, and you know, how do you feel about the value that we place on caregiving in the U.S.?
Currently, we don't. Currently, there is no value in that. I mean, as she talked about, the pay rate in itself shows that we're not valued. It just shows that we're here and we're doing a job. And ultimately, culturally, we have been raised to be caregivers, to take care of one another, to take care of our communities. And just because it's something that we do naturally doesn't mean that we don't deserve the payment for it.
Right.
And I think that when it comes to this, we do need something that does show appreciation. We do need something that's going to come along and say, hey, we appreciate the work you do, and not just a little pat on the back or a thank you or a trophy, because that trophy isn't going to put food on my table. It isn't going to keep the lights on. It isn't going to allow me to do the things that I need to do to help take care of my mom or take care of my daughter. And trust me, and I'm married. And it's still hard, you know. My husband and I, we work very hard to support our family, but like she said, we're both in a system of care to where we're giving out. He works in the school system, who yet again, we have people who are underpaid. And so ultimately, my hope is that these policies come along will not put people in a place, like I believe that it should put them in a place to where it's helping, but it also puts us in a place to where it's allowing them to help themselves. And it'll allow them to ultimately be able to come out of it. We don't want it to be like a stumbling block or something that they become dependent upon, but I understand that what she's doing is going to put us in a place to help ourselves. And that's ultimately what a system of care looks like. It brings me up, it brings me out, it brings me to.
Thank you so much for that. And Jen, I know you have to go, and I want to thank you both for joining us on this discussion. Thank you very much for all you're doing, and we'll certainly keep up with this.
Thank you, David, and thank you, Linnea. You're an inspiration, and you're the reason why we do this work. I'm so proud to be in this movement with you.
Thank you, Jen. Thank you, David. I appreciate the work that you're doing, and let's make it happen.
Let's do it. We got this.
Okay, very good. Well, I want to bring in now to the discussion some of the writers that we have that worked on some of these stories. We have Rhacel Parreñas, who is at USC and wrote a great story for us about the elder migrant workforce. We have Brittany Gibson, who's a Prospect Writing Fellow, who wrote two things actually for this issue. One, a short piece about caregiving in the UK, and another longer piece about some models for family care around the world. And we're also joined actually briefly, and I'm going to start with her, by Tasmiha Khan, who wrote for us about the state of caregiving during the pandemic. And Tasmiha, when you messaged me, you said that you're having some of you're manifesting some of the problems that we were just talking about with regard to childcare and things like that. So if you could just talk briefly about the article that you wrote for us and what you learned from it, because you really covered, how people were coping with family care during this pandemic.
Yeah, definitely. Thanks so much for having me, David. It's an honor to be here. I thought that when talking to the families that there was one recurrent theme, and that's that how broken our system is. And like I didn't mention earlier, that a lot of our work is underpaid and we're overworked. And right now, the pandemic really has magnified the crack in the system, and it's really imperative that Congress take action to try to fix that. And it's not just Congress, but also there needs to be a culture of change too. Right now, speaking personally, we have one son, I have one toddler, and we're just bouncing between me and my husband. And even though we have only one, it's super challenging because we both have full-time jobs, and we're just trying to figure out how to perform at the same time parent. And we don't have extended family or relatives that we could just drop them off, or childcare centers are closed. So it's really taking a toll on all of us.
Yeah, absolutely. And thank you for being here in the moments that you have in between. I know you talked to some people who are in the position that Linnea was, people in the sandwich kind of generation, caring for children and for parents at the same time. One thing that's in your story that you bring out is that the usual state of care networks, even though they are not robust in the United States, but the usual ones that we had before the pandemic are absolutely in a state of collapse. Could you talk about that with respect to childcare and just caregiving in general?
Sure. Yeah, I think many families are in a very hard place. One of my sources that I spoke to, she actually wanted to move out with her husband, just to have that privacy and just to be able to parent her kids the way she wanted to. But because of finances and the lack of childcare options, she wasn't able to. And she, at the same time, they had elderly parents. They're living with their in-laws right now. So it's between taking care of them at the same time trying to manage the kids. It's a very tough spot to be in. And that goes to show that, even elderly care, it's not just child care, it's also elderly care too that needs to be addressed. And that's something that often I feel like gets pushed to the side. And I think that's a problem because it's not just one segment of our population, but our whole family, right? They were all interconnected, and it's very important to take that into consideration and also create policies and also a culture of change that would accommodate every part of the family.
Yeah, absolutely. Well, thank you, Tasmiha. If you can stay on, that's great. If not, I totally understand. So thank you so much. Yeah, appreciate it. Thank you for being here. Certainly you bring out the state of long-term care and elder care, and maybe I'll bring in Rhacel Parreñas at this point because your story was really so much tied up in the aging of that care workforce. And I know it was based on a lot of deep research that you have been doing for a long, long time. Maybe talk about that research, how you got into it, and what your key takeaways were.
So first, it's Rhacel Parreñas.
Oh, I'm sorry, Rhacel.
Yeah, no, it's fine. I'm a professor at the University of Southern California, Dornside College of Letters and Arts, and I've been studying low-wage workers, particularly those from the Philippines and domestic workers, for more than 2 decades now. beginning with my dissertation research that eventually became the book, Servants of Globalization. And that was a comparison of Filipino migrant domestic workers in Rome and Los Angeles. And when I did that study, what I learned was that many of them had been mothers who had to leave their children behind in the country of origin. And so this experience of reproductive alienation is one that's actually still quite common today, and one that was, it centrally defined their experiences as migrant workers. And so, but I came into this question of looking into this question of retirement after I had actually visited Rome as a tourist in 2012. So at the central train station of Termini, I was surprised to run into one of my research participants, from, my dissertation in the 1990s. And I learned that she still worked as a domestic worker, and she was already in her late 60s. And this then made me wonder if whether or not her situation is exceptional. And then I found out that it is not. And so this question of retirement was something then that I decided to pursue and do research in. And for me, it was particularly important to do it because the question of retirement, not just for domestic workers, but for low-wage workers in general, is something that is totally understudied. And so, for example, if you look at the ILO Convention 189, which is the Convention for Domestic Workers, it does not explicitly mention the issue of retirement for domestic workers. And so after that, then I worked with a Filipino Worker Center in Los Angeles, and we conducted a survey to look at, the question of retirement for domestic workers.
Yeah, it's. I actually just got today a pitch from somebody about a 97-year-old woman who's being cared for by a 75-year-old woman.
Oh, wow. Yes.
How they coped during the pandemic, and how the 75-year-old decided to move in.
Yes.
With the 97-year-old. And I mean, your piece is just so rich about those kinds of stories, and just the inability to have these domestic workers build up any kind of nest egg so that they can retire because of the low wage nature of the work. So, I mean, and it seemingly that has not changed over, I mean, you started this in the 1990s. Like, is there any change here?
Yeah. So, so what did I learn? So first, what we're seeing is that there is this domestic worker life cycle. So domestic workers, when they're younger, they start doing nanny work, house cleaning, but then as they get older, if they stay in domestic work, they transition to elder care because of the slower pace of the job. And so they find themselves still having to work in older age because the informal nature of the job clearly hurts them. And in particular, in a survey I conducted with the Filipino Worker Center of Los Angeles, we found that the vast majority of employers do not contribute to the retirement, to the social security of domestic workers, even though they are legally obliged to do it. And so then, what this also tells us is that there is this myth and this common assumption in migration studies that migrants, even if they're low-wage workers, will somehow accumulate savings and then be able to take these savings and go retire in their country of origin. And this is not true. I found that those who are able to retire usually didn't do it because they had savings or that they had a pension or they received Social Security. It was often those who managed to successfully send their children to school, that their children were able to get professional jobs and then support them in old age. But unfortunately, we can't rely on every single low-wage migrant worker to have a successful child, right? Who will then continue this sort of informal economy of supporting one another. So this question then of what happens to domestic workers as they age, remains really vastly understudied. And we do have younger scholars, like for instance, Melanie Plasencia, who's writing her dissertation right now in ethnic studies at Berkeley. She's starting to look at this question, and her dissertation basically is on like garment workers and domestic workers in the Latinx community and what happens to them as they get older. But we really need more studies such as those, this very innovative one that this young scholar, Melanie Plasencia, is doing. But it's really vastly understudied at the moment.
Yeah, yeah. I mean, two things jump out at me, and the first that we've been talking about is the immigrant and nature of the workforce, and the nature of the workforce being largely women of color.
Mhm.
The second thing is that what we know from Bureau of Labor Statistics is that this is one of the fastest growing, if not the fastest growing profession in the United States.
Yes.
And when you have that level of demand, the fact that the average wage is between $11 and $12 an hour doesn't compute on an economic scale, but it speaks to how this profession has been neglected, seen. I mean, one of the things you bring out in your story is talking about how this is seen as sort of a natural state, that caregiving among some of these populations is seen as natural, and therefore it doesn't need to be compensated highly, I guess. Could you talk about that?
Yeah, and so what, as you just mentioned, as Aijen just mentioned, domestic workers are severely, underpaid, and their low compensation manifests in different ways. Not just like the wage rate, but it's also on the fact that employers don't contribute to their Social Security, the fact that employers are not likely to compensate them if they go on vacation. There's no paid vacation for domestic workers. If their employers are out of town, it's likely they're going to be uncompensated. So it's just amalgamation of different ways of neglected compensation and recognition of this labor. So it's not, so we have to look beyond the wage when we think about how they're uncompensated workers. And so Filipinos, feel that, the people that I mostly study, they feel this vulnerability, they feel this expendability. So, they know that, their employers don't really value their work. And so what they like to think of themselves as is that they're really good at this job, and that's what makes them expendable, is that they're really, really good at it. And so it really speaks about their vulnerability, why they cling on to this identity. And so a lot of them brag about Filipinos being naturally suited to do this work. Filipinos are genetically disposed to be good care workers, that we are superior care workers. And that narrative is, you really have to look at that as a strategy that they employ to make themselves less expendable,
Mm-hmm.
and so, but the problem is employers also embrace this narrative and think that just because it's so easy for them, we therefore should not compensate them. But then that's really just the wrong attitude to have, because at the end of the day, it still is work, it still is labor, it's still a profession. So you should pay them, even if let's say they're naturally good at it, right? Which is a narrative that many Filipinos repeatedly shared with me in my discussions with them.
I mean, the business world, if someone's good at something, you pay them more, but in
Yes.
caregiving, if they're good at it, you pay them less.
Yes.
Well, Rhacel, thank you. I'm going to turn over to Brittany Gibson right now, our writing fellow at the American Prospect. And you wrote a couple stories for this issue, and one is a little bit tied to this. You look at caregiving in the UK, which is somewhat unique and has its own kind of idiosyncrasies. Could you talk about what the picture looks like in the UK?
Yes, absolutely. And I should just say I've learned a lot from the caregiving issue from other writers, people on this panel. I became a functional expert for this issue, but I learned so much from all the content. In the UK, for that story, I did what I explored was two parts, so on the part of the workers, the carers, as they're called in Great Britain, I learned about how they are underpaid, kind of the same situation that was just being spoken about. A big issue for them as well is not being paid in between visits of homes, being forced to do more home visits for the elderly carers, the elderly people they're caring for. And at one point, their schedules were being so overloaded that visits were lasting less than 15 minutes. And in those 15 minutes, they were meant to, bathe, feed, talk to, sometimes do laundry for, just a whole host of tasks that it would have been impossible to do a full comprehensive visit. And then on the other side, there's of course the patients, and I focus specifically on the elderly people that are getting the home visits from carers in the UK. And so they're on the flip side of that, receiving a 15-minute visit where they're supposed to get a comprehensive service, but it was just becoming impossible. And you mentioned briefly the economics of the financial crisis. The UK was also part of that. It started years of austerity. And so as the UK government was cutting funding for carers, cutting funding for home carers, these home visits, the number of people that needed those services was also increasing. So naturally, you saw a decline in quality of that. And it's similar to also what was just said, the age of carers in the UK, at least of the data I looked at in the last 10 or so years, maybe 15 years, the carers have been aging and increasing in age. I don't remember off the top of my head exactly where the range is now, but it's, older people caring for even older people in the UK.
Right. Thank you for that. And then the other piece you did, which was really on the solution side of our issue, also had an international focus. You looked at areas around the world that have done a better job than the United States in terms of a care infrastructure. And I know two of the countries that you looked at that really had more of a fully funded elder care system were the Netherlands and help me out, Germany, I believe, right?
Yes.
Yeah. So talk about what they do and maybe how that can be applied here.
Oh, yes, absolutely. As to how it can be applied here, it's difficult to say. I think what is unique about a lot of Western European countries that have thought about caring, and Germany and the Netherlands are definitely leaders in it, is they've really thought about how it can work within their healthcare system and also their work system. So Germany and the Netherlands are unique because they've, fully funded. They've thought out where we need to invest with money, not just words, into these systems. And they've also thought about, how it can work with their own health system. So it can get pretty wonky. The Netherlands has a very mostly private system, I think entirely private. Germany's got more of a mix, but mostly public. But they've thought about how to fund everything out. And what I found was, for example, one program specifically in Germany, it allowed people that wanted to care for family members. So it went even further than professional carers, which can happen in a home institute for elderly people or with home services. It went even further with a third option of when family members want to care for their older family members or other family members. And, through their very stable employment system, they worked out an entire scheme where you could take 2 years from, going from full-time work to part-time work with your employer and still receive 75% of your salary. And then when you were able to return to work after those 2 years, then you would still just receive 75% until it evened out. So it gave you, there's just more flexibility because they've really thought about how to fund that. Another country I'd like to highlight in Western Europe was Italy. They're not quite as organized with the funding as the Dutch and the Germans, but they also had a very interesting system that I thought tied in well with what we know about Italy culturally. And that was they have a system where you can care for a family member, but up to several degrees of separation, 3 degrees. So it wouldn't just be like a sandwich situation where someone in the middle generation was caring for parents and for children. There you could have an a nephew caring for an uncle, a grandchild caring for a grandparent, and it really expanded your options and your choices. So that was one end of the spectrum, and with the international comparison.
Yeah, that's a very important point about the extended family and caregiving and the definition of what qualifies under family leave. For example, the U.S. has, different states have taken this on, and they have come to different definitions. So that's an interesting aspect. Was there anything that surprised you in the way that countries around the world handle this, these care needs?
Yes and no. I think what was surprising, and this is something I learned a lot from doing research and looking at what Ezekiel Emanuel was saying about healthcare. Obviously, he's a very well-known healthcare expert,
Right.
and he spoke with Ezra Klein on Vox, going really in detail about healthcare. And so what surprised me is how he is pretty nuanced about saying there's no best system. And I think that's something that we can really consider and learn from. Every system has issues. Every system has to work within a certain culture and has to respond to what's already going on in that country. But there's always room for improvement. That really stuck out with me with the UK story, especially because in the US, when we think about healthcare and countries that are doing it well, everyone points to in the US, the UK single payer system. But really there's still issues and they still need to progress. So, even though the US is ranked quite highly for both childcare and elderly care in terms of quality, when we think about access, when we think about, how can we pay, who's paying for this and how much, is this system really helping the most number of people, then the answer is no. And that leads to more interesting questions. And so that's what surprised me a lot, just how complicated it is, which experts will say, of course.
Right. Thank you. Yeah, I mean, that gets at, the access question really gets at what, when you're talking about solutions, how smoothing this out and making this a universal fund so that everybody has a stake in it, and that the rush of needs don't all come at once, because usually you have care needs when you can least afford them. Either you're a young mother, a young parent, and you need childcare when you're at the early stage of your career, or you're elderly and you might be on a fixed income and you need care at a stage of retirement where you don't have the affordable needs. So the idea is to smooth that out, spread it so that everybody plays a role in it. So Rhacel, I know that your work is primarily looking at focusing on the problem
Yes.
or the specifics, but I'm wondering how you think that the care workforce, how would you see ameliorating this situation for them? What steps do you think might be able to be taken so that we don't have the kinds of situations that you were talking about?
So I think, one key step to this, and I know the National Domestic Worker Alliance has, worked tremendously in standardizing domestic work. And that's definitely, still a challenge in this country. I think perhaps penalizing employers that don't contribute to the social security of their domestic workers. So they're required to put in at least 7.5% into Social Security and Medicaid taxes of domestic workers. I think that's like one initial first step. I think definitely like a fund for them so that they could retire, looking at the universal family, care fund to include, the needs of low wage workers is definitely, one more issue that we have to look into.
Yeah. And in your experience, because we have some other articles in the series about organizing among domestic workers,
Yes.
and organizing for better conditions, better pay, and things like that. And it strikes me that that's a very difficult scenario, because you don't have a water cooler, you don't have a common office, you have this atomized situation with individual care recipients, individual families that are setting wages at some level. In the people that you've studied and talked to, are they engaging in organizing, and are they trying to establish better rights in the workplace, and how difficult is that?
Yeah. So I think, as you know, because domestic work is so isolated, it's very hard to organize them. And so I do know that, from my experience, participation rates for unions is quite low for the average domestic worker. But what's interesting is that during this pandemic, both the Filipino Workers Center in Los Angeles and their counterpart, Damayan in New York, has seen like a surge in membership, like a surge in participation among domestic workers. And this is because many domestic workers, due to the informal nature of their job, found themselves the most expendable, the most disposable, as employers are facing financial difficulty, as, they find themselves staying at home, like the first group that they'll get rid of would be domestic workers without even really thinking about sort of the well-being of this person that they've long depended on. Secondly, they'll, make demands on them where before they would be a live-in worker. Now it's like, we want you isolated. We want you to stay with us 24/7. You can't go out because of the pandemic. And they're demanding that also from domestic workers, especially of elderly caregivers. But the compensation that they're getting is actually not equal to the labor that is expected of them. And so you do see that in times of crises and in times of need, they, that they will also, reach out to these organizations. And so then the challenge is to let them also realize, let others realize that, that these organizations really serve a purpose and shouldn't just be turned to when you need something, right? And that this sort of sense of responsibility to others, if you're not so much in need, is something we could probably really also work on building among this group of workers.
Okay, great. Thank you. Brittany, we just have a couple minutes left. And just wondering if you have any final thoughts. I mean, you said you learned so much from the issue. I was wondering maybe you could talk about some of the topics we didn't represent here in this discussion, and things that you might have taken away from our special issue.
Yeah, of course. Well, if I did all of that, we'd be here for another couple more hours. I'll say one thing that we talked about a little bit, but it was, caregiving is so large, but it's the second half of my other piece, and that was for younger children. And I talk about it a little bit, international comparisons with Canada and France, both of which have really well-funded, expanded, universal early childhood programs. In France, you can, start dropping your child off for a day program of care from 3 months old, which is very, very young for a very affordable rate. There's there's a formula based on your income, but there's max levels, and it can average out as low as $4 a day, $4 a day. Canada has a very similar system. And after I reported the story, but before it was published, I saw Justin Trudeau come out and say, in Canada's Recovery Now, that childcare aspect, continuing that early childhood daycare education program, is going to be important for everyone. He said, we're going to continue funding this. We're going to continue, because obviously they do pay the carers more than $4 a day in these programs. The government has to fund everything else, including the benefits, salaries, everything like that. But they say, he came out and said, for Canada as a whole, for our progress, for our economy, and for our citizens, it is a net positive, even though we spend more money on it. And so that's just last note I'd like to add.
Absolutely, yeah. Thank you for that. I mean, that's the thing, right? You can't put 50 toddlers in a room and expect one instructor, right? So that's why there is a cost attached to it, and absent federal support, there's just no way to make it affordable for families and rewarding in terms of a living wage for the instructors and for the providers. So, that's a good place to leave it, with a model from that we can actually do this. And we're seeing this more and more become a political issue. Vice President Biden has a $700 billion care plan that really centers workers. We saw during the primaries, universal child care systems proposed by Elizabeth Warren, by Bernie Sanders. So we're starting to see this movement kind of grow, and we're certainly going to be following it at the American Prospect. Well, I want to thank Rhacel Parreñas of USC. Thank you to Brittany Gibson. Thank you to Tasmia Khan, Aijen Poo, Linnea, whose last name is Lynnea Redmon-Williams. There it is. And I've been David Dayen, executive editor. And we're going to stay with this topic as, once again, prospect.org/family care, where you can find every story from this special issue. And also in the future, as we do future stories about family care, that's where they'll live too. So keep up with us and check out the special issue. Thanks, everyone.
Thank you. Thank you. Bye.